This is how I became an emergency medical technician at 16 years old. Hi guys, my name is Bruna, and today I'm here to share how I got into the field and what this means for me, the different opportunities you can get being an EMT. My video today is split into 3 parts. In part 1, we'll discuss what an EMT is and why you would want to become one. In part 2, we'll discuss when one can be an EMT and how you can get there. And in part 3, I'll be giving you my personal advice. I've been working in the ambulance since, as mentioned, I was 16 years old. I'm now 18 and a lot has changed for me. My perspectives have changed, my mind has opened, and overall I'll be sharing my experience and any advice that you might want to know before you get into the field. And this video, just like many of my future videos, are for educational purposes. This means that I'm here to inform you of the job and give you my personal advice on it. I think that one of the main reasons I'm here today and why I want to make EMS videos is because when I was prepping for my NREMT exam, which is the exam EMTs have to take in order to become certified, I saw a lack of YouTube videos. Of course, there were some wonderful YouTube channels, which I will mention later, that I used heavily preparing for the exam. But I wanted something more. I wanted something more in depth and something more oriented towards just EMS. I took my test through the NREMT, which stands for the National Registry of Emergency Medical Technicians. I'm not entirely sure if other places administer the test, but I know that the NREMT is the most widely known one. It's the one that I have, so a lot of the information I'll be including in the video is surrounding the NREMT and how they do what they do. So part 1, what is an EMT and why would you want to become one? An EMT is a healthcare professional who works in an ambulance in response to 911 calls. This is what I currently do, and often it is rescue squads and fire stations that respond to 911 calls. As an EMT, you can work in different places, which we'll also get into later. They're most widely known for working with 911 and getting calls and responding to them as readily as possible. So some common misconceptions about EMTs. EMTs are not paramedics. Paramedics spend a lot more time studying. They usually take a community college course of about 2 years, whereas EMTs can even take summer courses for like 2 weeks, which is a very short amount of time, but it does happen. There's significant differences in education. Paramedics are usually the ones that administer drugs as well. EMTs can actually only administer about 7 drugs in Virginia. In other words, while both work in the ambulance, paramedics are required to complete more extensive training and are therefore qualified to perform more advanced procedures. One of these is intubation. I have been taught how to assist in intubation, but I'll never be able to, as an EMT, intubate anyone. There are tools very similar to intubation tools. I'll put the picture of the intubation tools and the iGel side by side. They look very similar, but the difference is the technique in which you insert it. So touching into these different branches of EMS, there are actually 4 different levels to emergency medical services. And once again, this is according to the NREMT. This can be applied to every other state as well. First, as mentioned, we have the emergency medical responder. Responders include any personnel like firefighters and police which are trained enough until the EMT gets there. The next level up is the EMT, or the emergency medical technician, and they are in the ambulances. They can only do a certain number of things. Up we have the AEMT, advanced EMT, which isn't as commonly known. I myself don't know too much about it. At my station, I've only seen EMTs and paramedics. Right above that is the paramedic, and in the ambulance, that's the highest level you'll see. Let's get into why you should want to become an EMT. Personally, I stumbled upon this whole idea of being an EMT. The number one thing that I feel is very important, even though there's a lot of benefits to being an EMT, EMTs make a huge difference in their community. EMTs are often the first ones on scene along with police and firefighters. They can really shape the experience for a patient. We're very careful as to how we react, how we come across to the patient, and that really does make a difference for them. Number 2, every shift is unique. You really never get the same experience because the details change here and there, even if they are very similar. There's definitely a thrill to not knowing what to expect every time you go to work. Number 3, and this is very, very big, especially if you're a high school student, Career opportunities and growth peak when you start involving yourself in EMS, especially if you're trying to go deeper into the medical field in college. It's really a gateway to a variety of healthcare careers, and it gives you base knowledge of healthcare. Rescue squads and EMS stations put a lot of emphasis on continuing education. There's even something I just found out where you can take continuing online courses for free, which is set up for every active EMT in the United States. And I can do a different video on that. Kind of branching off of that is you get a lot of networking experiences as well. You end up recognizing the same nurses you meet a couple times in the hospital. You end up recognizing the same doctors that you see every once in a while, and eventually you kind of warm up to each other and you make small talk. Knowing people is always something that is valuable. And also branching off on the career opportunities part, as I mentioned, EMTs don't have to work only in an ambulance. I myself, my very first kind of healthcare job was a transport company. I was working in an ambulance, but it wasn't 911. It was very low pressure. We just kind of transported patients between hospitals, between their home and the hospital. If you're not entirely ready for 911, it's a great way to start. So really, as an EMT, you can do transport, you can do 911, you can be a patient care tech at a hospital. That's a really wonderful experience if you want to learn to do IVs and more complex little things that they allow at a hospital but don't allow on the ambulance. As a patient care tech, you can also pick what floor of the hospital you want to work at most of the time. So you can be a surgery tech, you can be really whatever they have available at the hospital. All of my friends that are EMTs, most of them do work as a patient care tech and they absolutely love it. Super exciting, as well as the ambulance. It's just a preference thing. You can really branch out in so many different ways, which is one of my favorite parts about being an EMT. Like, you never really know where it's going to take you. Another really fun thing is that you get a lot of travel and entertainment experience. So members of my rescue squad were recently talking to me about how they want to volunteer in Honduras, in Guatemala, and the fact that you have that license, that nationally registered license, makes you qualified to be able to work wherever as a healthcare professional. My rescue squad has volunteered at NASCAR races, graduations, boxing matches, sports events. As an EMT, you can see so many things for free. Yes, you do work for free if you work at a rescue squad. It's a two-way exchange and it's really fun. Just as a reminder, I am mentioning all these wonderful things about being an EMT, but your priority should always be on the patient 100%. You may be at an event watching something, but you should always keep an eye out on everyone, because especially big events, when it's hot outside, people tend to get dehydrated, or you really never know what's going to happen. And scene safety, patient priority, and your own safety are of utmost importance. Another really big thing, if you're in high school, EMS will make you shine on college applications. I myself have gotten such a wonderful college opportunity ahead of me because I have so much volunteer experience in healthcare already. That provider to patient experience early on can really make you stand out, and it starts building your maturity. Flexible schedules. I've had a variety of jobs. EMS is the number one most flexible schedule. I could work once a month or every single day. Teamwork and communication skills improve drastically. You're communicating with people all the time, the patients, your coworkers, so you are bound to develop that over time. Personal fulfillment. There's a lot of peace in helping others. I feel so good after a shift. It doesn't matter how the shift went. I know that my contribution really helped someone and their family, so that's what matters. A lot of hospitals have snack rooms for EMS, which are completely free. Sometimes there's slushies, there's like any type of snack, ice cream, like it's just a bunch of stuff, and it's super sweet that hospitals do that. And lastly, skill and educational development. There are courses online that you can take for free just because you're an EMT. I think that's super valuable to continue learning and continue being a great healthcare professional. So part 2, when can you be an EMT and how? The state requirements may vary. The National Registry is actually pretty consistent nationwide. It's the main place to get certified. So if you want to be an EMT, I would start by going on their website. I'm going to explain the different steps you have to take, but I'll make sure to link everything I'm mentioning down below. It does say it has a minimum age requirement of 18, but I get certified at 16. I think that it really depends where you live. You kind of have to look at your state's rules and regulations on that to make sure that everything is good. So how did I personally become an EMT? I was actually able to attend a career technical education center alongside my high school education, and we alternated days. I know a lot of people that do take summer courses and they do just fine, and I think it's very important to do your own bookwork regardless of how you choose to gain your EMS education. So for the people that attended summer camps and did summer courses, they searched up their state approved EMS courses, and you can do this for any state. Occasionally, the American Red Cross does offer courses for EMS. Supposedly, I didn't really see much on there, but you can also try and see if there's some going on around your area. The biggest thing with the Red Cross is getting CPR and first aid certified before you start your course, because that's a requirement, at least in Virginia, that I'll get into a little bit later. You can take an EMT course through community colleges most of the time. So from the Virginia Department of Health website, the requirements to become an EMT are
being proficient in reading, writing, and speaking the English language, being a minimum of 16 years of age at the beginning.
Like I said, I'll link that down below. Just a couple things to point out. I did have to get drug tested, and I had to get my blood drawn for a variety of tests during my class. We had to prove vaccination. TB tests are huge, so you have to get a TB titer. Lastly, to close off part 2, I'm just going to kind of run down the steps to get certified, at least through the NREMT. I had to get CPR first aid certified before my course started. When my course did start, we just made sure to go over the entire content. At the very end, we did something called a psychomotor exam, where they evaluate your skill in hands-on situations. You're gonna have a scenario and a mannequin to practice on, or it could be a real person depending on where you go. And they'll give you a scenario, and you have to take the proper steps according to the trauma assessment sheets or medical assessment sheets that you're going to learn in class. You can only move on if you pass. If you don't pass, there's different steps you have to take. So once you do pass the psychomotor exam, you are cleared to take the multiple choice final exam for the NREMT. So for the final exam, you have to go to a test center where you're put in like a private area. You can't have your phone, your keys, anything. They kind of like take anything away from you, and you sit there and there's a computer ready for you. You do need an ID, but there's someone proctoring you the entire time. There's going to be different people taking different tests. NREMT is very weird about their tests. You can have a minimum of 70 questions, but it may go above that. Mine capped off at 70 questions, but normally it only does that when you either failed miserably or passed with flying colors. The test has to analyze whether you kind of know what's going on. But if it does cap you at 70, don't freak out. Like, I was freaking out because I thought I failed, but really I passed. You can take the test 2 times before I think you have to retake a class or like spend a day remediating or something. To close off the video, it might be a little bit long, but I wanted to make sure to include a pretty detailed overview. I'm just going to mention a couple books that I used in my genuine experience. I think it's an experience that has really been worth it for me. I've met a lot of people. My social skills increased dramatically. It's fun. You learn. Things happen, like it's a difficult job at times, but the community around you is really supportive. Anybody I've ever met in EMS is super supportive, and they're just the best. When I was studying, the YouTubers that I did really binge watch were the paramedic coach and Armando. I don't want to mispronounce his last name, so I'm just gonna link both of them below. But the paramedic coach is more oriented towards EMS, and Armando's YouTube channel is more oriented towards physiological principles and how the body works, and like the heart, for example. So both of them were super helpful. I used 2 different books. One of them was a textbook for my class, which I absolutely love. That was the Emergency Care 14th edition by Daniel Limmer. And the other book I used was more at the end of my course to like kind of run down everything. This is the second book I used. As you can see, it's a little annotated. It's super helpful. It kind of runs down everything, not in super detailed ways, but just enough for you to understand. And this was also recommended by an emergency care tech at a hospital. He said this was the best thing you could invest in, and he was right. So if you don't want to buy a whole textbook, this will do you just fine. My goal here is to educate you all on EMS, something that I love very much. So thank you all for watching, and I'll see you in my next video.